Welcome back to Velsheen Rule. Please pay attention to this. Right now, a nationwide measles outbreak is getting worse. The CDC now confirms 101 cases since the start of the year across 10 states, coast to coast. That is 22 more cases since the agency's last report. In the state of Washington alone, 55 cases. The governor there has declared a state of emergency. The CDC says the disease is spreading among those who either have not received the measles vaccine at all or who haven't received the second dose. Officials say almost all of the 101 cases occurred in kids younger than 10 whose parents had chosen not to vaccinate them. Measles is a highly contagious disease caused by a virus. It spreads through coughing and sneezing. Health officials say if you have not been vaccinated and you are in a room with someone who has measles, you've got a 90% chance of getting it. Symptoms include a high fever, as high as 105 degrees. Also, a cough, red eyes, and a red rash that spreads. If you get it, you are likely to be sick for weeks. Now, it is preventable. The CDC says the measles vaccine is 97% effective after 2 doses, 93% effective after 1 dose, and it is safe for most people out there. Exceptions include pregnant women and people who already have weakened immune systems. This is such an important story, Ali.
It's unbelievable. Joining us now is NBC News medical contributor Dr. Natalie Azar. Natalie, we declared that measles was eliminated in the year 2000.
19 years ago.
How does this happen?
Then we had, as we know, a really vocal anti-vaccine movement that has generated a lot of misinformation to the tune of worldwide measles cases have increased to 2.3 million last year. That's an increase of about 50%. So much so that the World Health Organization has now listed vaccine hesitancy as one of the top 10 threats of global health.
So we go through all of human history. We try and find vaccines so that people don't get these highly contagious diseases, which have killed people and reduced effectiveness for hundreds of years. And now we're moving backwards on some of this.
Okay, but can we talk about the heart of the anti-vaccine movement?
Yes.
Because much of it seemed to be centered around this idea that vaccines cause optimism. That has since been debunked. What I just said.
Optimism, which is the way you think, you see? You are such an optimistic person.
You are an optimist.
Vaccines for you do cause optimism.
There you go.
But autism is the concern.
So let's be very clear about this. This was a research study in the BMJ from 1998.
What's that mean?
Oh, the British Medical Journal.
Got it.
Okay? By the guy of the name of Wakefield. The research has been fully discredited. The original paper was retracted. The doctor himself lost his license. So, debunked. Since 2003, the CDC has funded 9 different studies that have absolutely not drawn a conclusion or said that there is an association between, number one, MMR, that's the measles, mumps, rubella vaccine, and autism spectrum disorder, and also no association between thimerosal, which is the mercury issue, and autism spectrum disorder. And I want to make a note, too, that the measles vaccine does not contain mercury.
So even if you thought that was the case?
Even if you thought that was the case. The only one that does right now is a very small amount in a flu vaccine that's called a multi-dose vaccine. You can choose not to get that one if you would like to, but the amount that is in there and the type of mercury that is in there is not considered by CDC to be harmful.
How dangerous is it when kids get measles?
So look, I mean, I think the default position for a lot of anti-vaccine people is that, well, it's a childhood illness. You feel you have a little viral syndrome. You get over it. No big deal. As Stephanie pointed out, however, there can be some serious consequences from measles infection, namely pneumonia, renal failure. You can have hearing loss. You can have a life-threatening complication called encephalitis. And for me, as a physician, I am always most concerned about the more vulnerable populations, as you alluded to. These are the very young. These are people whose immune systems are compromised because of the medications they may be taking. Pregnant women, people with chronic illnesses, they are much more vulnerable to having a severe complication should they be exposed to and develop measles.
Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.